According to the World Health Organization, the number of people with diabetes has risen from 108 million in 1980 to 422 million in 2014. Diabetes is a chronic disease that affects how your body turns food into energy. If left uncontrolled, it can cause serious health complications, while medication is necessary for some people. Lifestyle changes and diet can help manage diabetes without medication. We will discuss lifestyle changes and diet tips that can help manage diabetes. 1. Exercise is a crucial component in managing diabetes without medication. It is well known that physical activity can help control blood sugar levels, but it also has other benefits for people with diabetes. Regular exercise helps the body use insulin more efficiently, which can lower blood sugar levels. Insulin is a hormone produced by the pancreas that helps regulate blood sugar levels. When the body becomes resistant to insulin, it can lead to high blood sugar levels, which is a hallmark of diabetes. In addition to improving insulin sensitivity, regular exercise can also help reduce body fat, which is an important factor in managing diabetes. Excess body fat can contribute to insulin resistance, making it more difficult for the body to use insulin properly. By reducing body fat, exercise can improve insulin sensitivity and help control blood sugar levels. The American Diabetes Association recommends that people with diabetes aim for at least 30 minutes of moderate intensity exercise most days of the week. Some good options include walking, swimming, cycling, or dancing. Resistance training can also be beneficial, as it can help build muscle mass and improve insulin sensitivity. Please subscribe to my channel now to see more video like this. Like and comment down below. 2. Reducing stress is also important in managing diabetes without medication. Stress can cause the body to release hormones like cortisol and adrenaline, which can raise blood sugar levels. Chronic stress can also lead to unhealthy coping mechanisms, like overeating or not exercising, which can make it more difficult to manage diabetes. There are many ways to reduce stress, including relaxation techniques like deep breathing, meditation, or yoga. These practices can help calm the mind and reduce the production of stress hormones. Other activities that can help reduce stress include reading, listening to music, spending time with friends and family, or engaging in hobbies like painting or gardening. In addition to reducing stress, getting enough sleep is also important for managing diabetes without medication. Lack of sleep can cause the body to produce stress hormones, which can raise blood sugar levels. It can also lead to unhealthy eating habits and a lack of energy for exercise. Aim for at least 7 to 8 hours of sleep each night, and try to stick to a consistent sleep schedule to help regulate your body's internal clock. Regular exercise and stress reduction techniques like relaxation and getting enough sleep are important components of managing diabetes without medication. Aim for at least 30 minutes of moderate intensity exercise most days of the week, and find activities that help you reduce stress and get enough rest. By incorporating these lifestyle changes into your daily routine, you can help manage your diabetes and improve your overall health and well-being. Remember to always consult with your healthcare provider before starting any new exercise program or making any significant changes to your lifestyle. 4. Eating a healthy diet is another critical component of managing diabetes without medication. A healthy diet can help control blood sugar levels, reduce the risk of complications, and improve overall health and well-being. Aim for a balanced diet that includes plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Fruits and vegetables are high in fiber, which can slow the absorption of carbohydrates and help control blood sugar levels. Whole grains, such as brown rice, quinoa, and whole wheat bread, are also high in fiber and can help promote satiety and prevent blood sugar spikes. Lean proteins, like chicken, fish, and tofu, can help build and repair muscles and stabilize blood sugar levels. Healthy fats, like those found in nuts, seeds, and avocado, can help reduce inflammation and improve heart health. It's also important to avoid processed and sugary foods, as these can cause spikes in blood sugar levels and contribute to insulin resistance. Limit your intake of foods like white bread, pasta, candy, and soda, and instead focus on whole, nutrient-dense foods. 5. Getting enough sleep and eating a healthy diet are essential components of managing diabetes without medication. Aim for at least 7 to 8 hours of sleep each night, and establish a regular sleep schedule to help regulate your body's internal clock. Eat a balanced diet that includes plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats, and limit your intake of processed and sugary foods. By incorporating these lifestyle changes into your daily routine, you can help manage your diabetes and improve your overall health and well-being. 6. Monitoring your blood sugar levels is crucial for managing diabetes without medication. Your doctor can recommend how often you should test your blood sugar levels, but generally, it is recommended to check your blood sugar levels at least once a day, preferably at the same time every day. This can help you make adjustments to your diet and lifestyle to better manage your diabetes and prevent complications. You can monitor your blood sugar levels at home using a blood glucose meter. This device measures the amount of sugar, glucose, in your blood by pricking your finger with a small needle and collecting a drop of blood on a test strip. The meter then displays your blood sugar level, which you can use to make adjustments to your diet and lifestyle as needed. Losing weight can also help manage diabetes without medication. If you are overweight or obese, losing weight can improve insulin sensitivity and lower blood sugar levels. Even losing a small amount of weight can have a big impact on blood sugar levels. Aim for a weight loss of 5 to 10% of your body weight, as this can significantly improve your overall health and well-being. To lose weight, it's important to focus on making lifestyle changes that are sustainable and healthy. Start by incorporating more physical activity into your daily routine, such as walking, swimming, or cycling. Aim for at least 30 minutes of moderate intensity exercise most days of the week. You can also make dietary changes to help you lose weight and manage diabetes. Aim for a balanced diet that includes plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid processed and sugary foods, as they can cause spikes in blood sugar levels and contribute to weight gain. It's also important to be mindful of portion sizes and to eat slowly and mindfully. Focus on savoring the flavors and textures of your food, and stop eating when you feel full. You can also try keeping a food diary to track what you eat and how it affects your blood sugar levels, which can help you make more informed choices about your diet. Monitoring your blood sugar levels and losing weight are important components of managing diabetes without medication. Monitor your blood sugar levels regularly and make adjustments to your diet and lifestyle as needed. Aim to lose 5 to 10% of your body weight through sustainable lifestyle changes like regular exercise and a healthy, balanced diet. By incorporating these strategies into your daily routine, you can help manage your diabetes and improve your overall health and well-being. 7. Quit smoking. Smoking can increase the risk of complications from diabetes, so it's important to quit smoking if you smoke. Your doctor can recommend smoking cessation techniques to help you quit. 8. Limit alcohol intake. Alcohol can cause blood sugar levels to fluctuate, so it's important to limit alcohol intake. Men should have no more than 2 drinks per day, while women should have no more than 1 drink per day. Conclusion: diabetes is a chronic disease that requires ongoing management. While medication is necessary for some people, lifestyle changes and diet can help manage diabetes without medication. Exercise regularly, reduce stress, get enough sleep, eat a healthy diet, monitor your blood sugar levels, lose weight, quit smoking, and limit alcohol intake. By making these changes, you can help manage your diabetes and reduce the risk of complications. Remember to talk to your doctor before making any changes to your diet or exercise routine. Subscribe to my channel now to see more video like this. Like and comment down below. Thank for watching.